So now that we have discussed the healthy hearing system, I want to go over the different types of hearing loss. There is conductive hearing loss, sensory neural hearing loss, and a mixed hearing loss. A conductive hearing loss is a problem with the outer or middle ear that prevents sound from reaching the inner ear. A conductive hearing loss could be congenital, so a child may present with microtia, which is a small outer ear, or atresia, which is the absence of an ear canal. Or it could be an acquired conductive loss, which means they may have a cerumen or earwax impaction that prevents sound from reaching their inner ear. Many conductive hearing losses can be treated either with time and medication, as with the case of a cerumen impaction or otitis media, or with surgery. And if there is a hearing loss that is present after this treatment, amplification devices can be used to help that sound reach the inner ear. In contrast, a sensory neural hearing loss can result from an impairment of the inner ear, the eighth cranial nerve, the brain stem, the midbrain, or the auditory cortex. Sensory neural hearing losses are often permanent and require a different communication mode in order for those individuals to communicate. A sensory neural hearing loss in a child prelingually could be caused from a variety of things. So this could be a maternal infection, it could just be the genetic makeup, or it could be an infection that the newborn acquired. An individual who has both sensory neural and conductive hearing loss is considered to have a mixed hearing loss. And so this could be a child that has a sensory neural hearing loss and also has an ear infection. So that conductive hearing loss is generally going to go away. There are different degrees of hearing loss that range from slight to profound in children. And so these levels of hearing loss correspond to the intensity of sound that is required for sound detection. Children with even a minimal hearing loss can really see some implications from that hearing loss on their education. Research has shown that there is a median third to fourth grade reading comprehension level for individuals with hearing loss. And this is really due to a reduced ability to analyze sounds and learning to decode those sounds. Children with hearing loss also have some speech production difficulties, and these can extend into both vowels and consonants. So some typical vowel errors that we see are neutralizations, substitutions, prolongations, and nasalizations. For consonants, we often see some voiced and voiceless confusion. We also see here some substitutions and distortions, as well as omissions and errors in consonant clusters. So these children oftentimes are more accurate with consonant sounds that are visible, and so they have additional challenges with affricates, fricatives, and glides. As speech and language pathologists, we can provide intervention on these aspects. But first, families have to choose what communication mode is best for them and their families before we can intervene.